Question 1. In which specific condition is the Frank-Starling mechanism most prominently involved within the cardiovascular system? A. Atherosclerosis. B. Cardiac tamponade. C. Hypertrophic cardiomyopathy. D. Pulmonary embolism. Correct answer is C. Hypertrophic cardiomyopathy. Question 2. Which of the following factors is primarily responsible for the Windkessel effect in the arterial system? A. Vasoconstriction. B. Arterial compliance. C. Sympathetic nervous system activation. D. Cardiac output. Correct answer is Question 3. Which of the following factors is not considered a major risk factor for developing coronary artery disease, CAD? A. High blood pressure. B. Elevated levels of high-density lipoprotein, HDL, cholesterol. C. Diabetes mellitus. D. Smoking. Correct answer is B. Elevated levels of high-density lipoprotein, HDL, cholesterol. Question 4. Which of the following statements accurately describes the function of the atrioventricular, AV, node in the human heart? A. It initiates each heartbeat by generating electrical impulses. B. It coordinates the contraction of the ventricles, ensuring blood is pumped efficiently. C. It regulates blood pressure by constricting and dilating blood vessels. D. It filters oxygen from the blood before it is distributed to the body. The correct answer is B. It coordinates the contraction of the ventricles, ensuring blood is pumped efficiently. Question 5. Which of the following factors is a hallmark feature of pericardial tamponade? A. Bradycardia. B. Hypertension. C. Elevated jugular venous pressure, JVP. D. Increased heart sounds, S3 and S4. Correct answer is C. Elevated jugular venous pressure, JVP. Question 6. Which of the following is a defining characteristic of pulse pressure? A. The difference between systolic and diastolic blood pressure. B. The speed at which blood flows through the aorta. C. The volume of blood ejected by the left ventricle per heartbeat. D. The pressure within the venous system during diastole. Correct answer is A. The difference between systolic and diastolic blood pressure. Question 7. Which of the following statements accurately describes the role of the P wave on an electrocardiogram, ECG? A. The P wave represents ventricular depolarization. B. The P wave corresponds to atrial repolarization. C. The P wave signifies the beginning of ventricular systole. D. The P wave indicates atrial depolarization. Correct answer is D. The P wave indicates atrial depolarization. Question 8. Which of the following factors is most directly responsible for the regulation of blood pressure in the short term through the baroreceptor reflex? A. Renin-angiotensin-aldosterone system, RAS. B. Release of atrial natriuretic peptide, ANP. C. Autonomic nervous system, ANS. D. Erythropoietin, EPO, secretion. Correct answer is C. Autonomic nervous system, ANS. Question 9. Which of the following statements accurately describes the role of the foramen ovale in fetal circulation? A. It connects the right atrium to the left atrium. B. It allows blood to bypass the fetal liver. C. It connects the aorta to the pulmonary artery. D. It regulates blood flow to the fetal brain. Correct answer is A. It connects the right atrium to the left atrium. Question 10. Which of the following factors primarily determines the afterload of the left ventricle in the context of cardiac physiology? A. Heart rate. B. Stroke volume. C. Peripheral vascular resistance. D. Preload. Correct answer is C. Peripheral vascular resistance. Question 11. Which of the following cardiac valves is characterized by having only 2 cusps, leaflets, instead of 3? A. Aortic valve. B. Mitral valve. C. Tricuspid valve. D. Pulmonary valve. Correct answer is A. Aortic valve. Question 12. Which of the following factors contributes significantly to the development of varicose veins in the legs? A. Arterial hypertension. B. Increased blood viscosity. C. Weakened venous valves. D. Hyperactive lymphatic system. Correct answer is C. Weakened venous valves. Question 13. Which of the following factors is a key determinant of the Frank-Starling mechanism in the heart? A. Heart rate. B. Stroke volume. C. Sympathetic nervous system activity. D. Cardiac output. Correct answer is B. Stroke volume. Question 14. Which of the following best describes the function of the endothelium in blood vessels? A. Regulating blood pressure through sympathetic nerve signals. B. Providing structural support and preventing vessel collapse. C. Facilitating the exchange of nutrients and gases between blood and tissues. D. Producing and releasing red blood cells into the bloodstream. Correct answer is C. Facilitating the exchange of nutrients and gases between blood and tissues. Question 15. Which of the following hormones is responsible for increasing the reabsorption of sodium and water by the kidneys, ultimately leading to increased blood volume and blood pressure? A. Insulin. B. Epinephrine. C. Aldosterone. D. Thyroxine, T4. Correct answer is C. Aldosterone. Question 16. Which of the following structures is responsible for oxygenating fetal blood while bypassing the lungs in utero? A. Ductus arteriosus. B. Foramen ovale. C. Umbilical vein. D. Pulmonary artery. Correct answer is A. Ductus arteriosus. Question 17. Which of the following heart chambers has the thickest muscular wall? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. Correct answer is D. Left ventricle. Question 18. What is the primary function of the sinoatrial SA node in the heart? A. Conducting electrical signals to the atria. B. Initiating and regulating the heartbeat. C. Transmitting impulses to the ventricles. D. Controlling heart rate during exercise. Correct answer is B. Initiating and regulating the heartbeat. Question 19. What is the primary function of the coronary arteries in the cardiovascular system? A. Regulating blood pressure in the heart. B. Carrying deoxygenated blood away from the heart. C. Supplying oxygen and nutrients to the heart muscle. D. Assisting in the formation of blood clots. Correct answer is C. Supplying oxygen and nutrients to the heart muscle. Question 20. Which of the following phenomena contributes to the atrial kick during the cardiac cycle? A. Atrioventricular, AV, node contraction. B. Ventricular depolarization. C. Atrial depolarization. D. Ventricular ejection. Correct answer is C. Atrial depolarization.